Okay, if I could have the board members come forward. Sometimes I have to remind Supervisor Graywall we're not on city time anymore. Good morning, everyone. I'd like to call this Board of Supervisor meeting to order. The date is April 27th. The time is 9:03. I'm going to ask everyone to please stand for a Pledge of Allegiance. I'm going to ask Dale Butler to please lead us in that pledge and then remain standing for an invocation from Mike Gunnarsson from the City Ministry Network.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Let's pray. Heavenly Father, thank you for this day. Thank you for our community. Thank you for the beauty around us and the resources you've given us as a community. Thank you for the freedoms we have and for a country in which we are free to have a voice in the governing process. I pray for our community, Stanislaus County. I pray that those who live here who are broken, addicted, and living without hope would find joy and hope and a deep sense of community in their lives. I pray that businesses would prosper, our schools would flourish, and our neighborhoods would experience peace and healthy relationships. May this truly be a great city to grow up in and grow old in for every citizen. I pray that you would bless our leaders here today who have been elected to these county positions of authority. I pray that you would bless their families and their friendships, their health, and their businesses. May each of them come to know the depth of your love for each of them. And I pray that you would give them wisdom and insight and integrity as they lead with courage and unity and humility. Guide their discussion and their decisions on every agenda item this morning. I ask this all in the name of Jesus. Amen. Thank you.
Do some reading. Before we get started, I would like to make a few announcements. This meeting is open to the public. To provide for social distancing, the Chamber's audience seating capacity is limited to approximately 30 persons. We do have overflow space and staff available to help you find a seat. Consistent with guidance issued by the California Department of Public Health, face coverings are available to all members of the audience and participants in this meeting. Under the guidance, there are exemptions for their use, and therefore the public may see some individuals during the meeting not using them. Public comments will be limited to 5 minutes at the discretion of the chair, depending on the number of speakers. Public comments submitted by email before the start of the meeting will be made part of the public record and distributed to the board members for their consideration. Please email your comments to the clerk of the board at cobsupport@stancounty.com and list public comment period or the agenda item number and the subject line of the email. You can observe the live stream meeting if you go to stancounty.com, go to the Board of Supervisors website, and there is a link. In addition, board meetings are broadcast live on local cable television on Channel 7 in Modesto, Channel 96 in Oakdale, and Channel 19 in the rest of the county. And I will tell you, for the first time, we are, although we don't have a direct link, we are converting over to YouTube. And we do have a link. I'm trying to make it work. But it is, because you can't find it on a direct link yet, we don't have enough followers, www.stancounty.com.bos, Board of Supervisors.youtube.com, stancounty.com.bos.youtube.com. So we got to get up to 100, so as you're sitting in the audience, if you have nothing to do, please get onto the link and watch us. Okay, now we're going to move on to item 3, presentation. It's commendation of Dale Butler for his service on the Latino Emergency Council. CEO Hayes.
Yes, thank you. Good morning, Chairman Chiesa, members of the board, and all those in attendance or watching today. It is truly my distinct privilege and honor to recognize Mr. Dale Butler with this commendation. So on behalf of the Board of Supervisors, community members, and county leadership, I wish to acknowledge and recognize Mr. Dale Butler for his outstanding service on the Stanislaus County Latino Emergency Council as he prepares to step down from his role on the LEC, an organization he helped build and shape for the benefit of our entire community. For those who may not be aware, the Stanislaus County Latino Emergency Council was formed in 2005-2006 as an emergency response network linked to the Latino community to share community resources and reach many of our most vulnerable individuals and families in times of greatest need. The LEC has proven successful in connecting the County Office of Emergency Services with the Latino community during a wide variety of public outreach efforts, including floods and weather events, multiple health initiatives like West Nile virus, bird flu, whooping cough, and of course, our most recent COVID-19 emergency pandemic. Maintaining effective communications throughout our community in these types of events can be the difference between life and death for those who call Stanislaus County home. And we are all better off for the work that Mr. Butler and others did to put this vision to life here in Stanislaus County. And I do want to acknowledge that the LEC was formed primarily under the leadership of Mr. Dale Butler, along with Jose Rodriguez, at the time El Concilio Executive Director, and David Jones, who was then our Stanislaus County Public Information Officer. Of course, we must also acknowledge that Mr. Butler is a proud Stanislaus County retiree who devoted 28 years of outstanding service to the entire community, whether working on financial reports, budget, or the county equal rights program. Through his many decades of public service, he has built a reputation as a compassionate, caring man dedicated to making a difference in every circle he participates in. The county is proud to have named our annual Equal Rights Award in honor of Mr. Dale Butler. On a personal note, Mr. Butler was one of the first leaders I met with when I joined the county organization about 20 years ago, and I'm very fortunate to have had the opportunity to see and learn from his good work within the organization on a first-hand basis. Regardless of the languages we speak or the roles we serve in our community, we can all learn from the life and legacy of public service Mr. Butler has built here in Stanislaus County. Thank you, Dale, for building the bridges that have linked our community together in the past, present, and for many decades to come. Job very well done, sir. Congratulations. Come on. So we have this snazzy commendation for you. You've seen one or two of these in your lifetime, I think, sir, right? Okay, so here, I'm going to go ahead and hand that to you and have an opportunity to speak.
Well, thank you, Board of Supervisors, Mr. Chairman of the Board, Vito Chiesa, former Stanislaus County Fair Board member with me some years back. I do want to thank, of course, our CEO, Jody Hayes, for that very, very nice recap on what the Latino Emergency Council has done over the past 15 years in Stanislaus County with respect to promoting emergency preparedness in the Latino community and beyond. You know, we do have an effective partnership with the Board of Supervisors with Stanislaus County, and of course with the Office of Emergency Services. It's an organization we work very, very closely with, or I have, during my 15-year tenure as president and co-founder of the Latino Emergency Council. We've had some great partners within the county join us on our LEC Board of Directors. Mr. David Jones served for 12 years on our LEC Board of Directors. He was one of the initial co-founders with me, and as Mr. Hayes mentioned, Jose Rodriguez from the El Concilio. And we appreciate that partnership, because working together, we have been able to achieve a lot in promoting emergency preparedness in Stanislaus County. Right now, at this time, we have Patrick Cavanaugh, who is a staff member from the CEO's office, serving as an LEC board member. And during the last year, I've worked very closely with a community manager Erica Ignacio in doing messaging within the Latino community. We've had something like 46 meetings in messaging COVID-19 during the past year, and I've worked very, very closely with Erica Ignacio. County has some great, great representatives. So I'm stepping down to pursue personal interests in my life at this stage. And for the last 15 years, I have to admit, being a member and leader within the Latino Emergency Council has been a great honor and pleasure for me. I do appreciate the great support the County Board of Supervisors has provided us. And with that, my sincerest thanks, and I'm honored by the recognition. Thank you so much.
So really quickly, Dale and I think he had just spoke, we served on the Fair Board together, which was a great experience in and of itself. I think that's where we originally met. And so I had a grand experience, and then since subsequently, now Dale's been involved in many things, and he's just talking about one of the issues, but he's been a true leader, and it proves to me over and over and over, if you set your mind to it, you can make a difference in the community. I don't know of anyone with more integrity than Dale. I truly mean that. You're an inspiration to myself and what you can accomplish, whether you're elected or not, just caring about your community. You've been at the top of the heap. I'm glad you're going to take some personal time, because you've given, if I went back, it's probably about 40 years, the last 40-some years of your life, you've dedicated it to the betterment of the community. And I'm sure you won't stop because you have too much institutional knowledge. But again, on behalf of the Board of Supervisors, I congratulate you. I thank you. I want to just tell one quick story. Back in 2012, there was a summit through LEC, which was a vision of Dale's, and they came to me, and I think David had said, would you sponsor? And the ability to bring, I think it was about 60 to 80 groups together, different groups, and we talk about the collaborative process. I sponsored the event, and I thought it went fantastic. And just that's the way you build leadership in this community, by doing collaborative efforts. So again, Dale, on behalf of the board, thank you very much. We're going to go up here really quickly and take a picture, if that's okay.
Okay. All right, 1, 2, 3. And one more here. 1, 2, 3. Great, thank you.
Feel lonely over here.
You're not by yourself.
Oh, Jody.
Okay, we'll move on to item 3-2, declaring April 2021 as Child Abuse Prevention Month. Christine and Lori.
Good morning, Chairman Case, Supervisor Withrow, Supervisor Condit, Supervisor Greenwell. Good morning, CEO Hayes and Mr. Bose. My name is Christine Huber, and I am the Assistant Director over Adult Child and Family Services at the Community Service Agency. And with me today is Lori Schumacher, who is the Program Director of Regional Services at Center for Human Services. We're here today, though, as the co-chairs of the Child Abuse Prevention Council here in Stanislaus County to share with you some of the exciting work that is happening to ensure that families are strong and children are not abused. Other members of CAVC joining us today are Sandra Genova from Aspiranet, Holly Grace Curry from Havens Women's Center, and Jesus Vega, a lead case manager from Parent Resource Center. Also, many of the members are watching online and supporting this effort from afar. We appreciate everyone's support today. Before we kind of dive into what the Child Abuse Prevention Council is doing, we wanted to share some statistics with you. And I have 2019 and 2020 data up here. 2019 is our official data as published through UC Berkeley in partnership with the California Department of Social Services. 2020 numbers have not been posted yet, so these are not official numbers. We pull them from a different data system, and there could potentially be issues with duplications, children not counted, things like that. So there's some work that has to happen. And so they're not necessarily equal comparable, but we wanted to show you what information that we had. So you'll see in 2019, we had about 9,400 children that were reported to our hotline. We found 24% of those children were found to be abused and neglected. And I know there's an interest by you of education and mandated reporting, so I pulled the numbers to look at how many of these reports were made by someone in education. And in 2019, 19% of our reports, so about 1 in 5, came from education. In 2020, you can see that our numbers did decrease, but our finding of abuse or neglect increased, so we're at 35% of the total numbers. We also, when I pulled the information, 99% were reported by a teacher or school personnel. And I will share that when I looked at the total numbers and looking at September of 2020 and comparing it to September of 2019, our numbers of referrals and rates did go back to what we would consider normal. So September, October, and to the present, the numbers are trending the same, similar to 2019. But definitely in April through August, our numbers were lower when compared to 2019. So the Stanislaus Child Abuse Prevention Council. Our mission is to actively develop, support, and coordinate community efforts and awareness to prevent child abuse and heal its effect. The Child Abuse Prevention Council was established by the Board of Supervisors in 2002 under the authority of the Welfare and Institution Codes. We really have 3 main roles in our community. We are a catalyst. We make significant, meaningful change happen by sparking system change to prioritize the prevention of child maltreatment. We are a convener. We bring formal and non-traditional partners together, create a safe, inclusive space for partners to innovate prevention systems and programs. And we are a coordinator. We align activities aimed at the prevention of child abuse and neglect, promoting child, family, and community well-being. The Child Abuse Prevention Council currently has 15 members. And we have another 9 vacancies. You can see it's made up of county government, community nonprofits, we have parents, we have community members that make up our team. This year, our strategic plan is focuses on building capacity, being data-driven, and family strengthening activities. We also have been focused on broadening our membership. And so this year, one of our goals, and we've been very happy that we've been able to partner with the Interfaith Council and add the faith community and some other community organizations to our group. So I'm going to turn it over to Lori now to explain more about the family strengthening activities.
Great. Thank you, Christine. And it's a pleasure to be here and to share this work with you all. So really our focus for the last 7 years has been around strengthening families, and there is a framework that I'll talk a little bit more about so you understand really what our foundation is. But we have engaged many of you, others here in the room, and other partners throughout the community to really develop a vision of what strong families look like, and specifically what that takes to do in Stanislaus County, and how important it is for us, all of us, to work together, no matter who we are or what we're doing. So that has been our focus. We have We have had large convenings. We've provided training through our family resource centers and other partnerships with state agencies such as Strategies 2.0. Through the Office of Child Abuse Prevention, we have trained lots of people here in the community in protective factors so that they can in turn train their partners and their staff and others that they're connected to. We've created parent cafe facilitators here in the county, folks who will engage parents in strength-based conversation and connect them to each other as a way to build their own capacity. So we've done a lot of work. You heard Christine talk a little bit about our strategic plan, and it's very focused on building protective factors. Individual protective factors in our county, our goal is really to support folks who are the most vulnerable, and we can do that by focusing on building protective factors that will help families deal with some of the challenges that they face, whether it's substance abuse or they've got a history of violence or they're in poverty, whatever it is. Protective factors can really make an impact on positive outcomes for families. So a little bit about protective factors and the Strengthening Families framework. Back in 2003, an organization called the Center for Study on Social Policy was doing research in early education programs. So they were working with programs all across the nation, in Alaska and Michigan, in North Carolina and California and Texas. And what they began to discover was families that were doing well, no matter their social indices, their geography, their income, they began to learn that the families that were having the most positive outcomes and that were doing well, even despite some of their challenges, had some protective factors that supported their development and really the health and well-being of their family and their children. And so they developed the Strengthening Families framework, and the foundation of that are these protective factors that you see. And what they discovered was the families that have strength in each of these protective factor areas are likely to have really terrific outcomes, not only as parents, but as seeing positive development in their children. And when families have stronger protective factors, there's less likelihood that there will be abuse and neglect present within that family, and that the children will again develop in safe and healthy homes. So first one, parental resilience. And these are things that, these are things that are common not to just families that systems work. This is really about every family. And you may recognize some of these things in your own family that were strong for you. Parental resilience, that is really all about parents being able to handle what comes at them that's challenging. And it's their ability to respond to that, even if it's challenging, to be able to bounce back, to manage stress. When they're in a grocery store and they're trying to get out of the grocery store, and the child wants candy and is demanding that, managing all those situations, or even more serious things that happen in their lives. So parental resilience is very important. Social connections. Everyone needs social connections. I do, you do, certainly all of our parents and children do. And this is really about being connected to other people, to having someone that you can call on when you need some support or you just need someone to talk to. And, I think we can all agree there's been no time in our lifetime other than what we've experienced the last year with the pandemic that has really brought that into focus. We couldn't always necessarily be with people, but we could be in touch with people. And that's really important for everyone. It brings you out of isolation, whether it's virtually or in person. Having a family member or a friend that you're connected to is really, really important. So that is a protective factor. Another one is knowledge of parenting and child development. So really important for parents to understand what's normal and to know how to manage the development and the phases of development that their children are going through, whether they're 3 or whether they're 16. All parents need support in education, so it's important that they have opportunities to be connected to learning throughout the stage of their child's development. The fourth one, concrete support in times of need. This is really significant. This is referring to the basic things that we all need, right? Like food and shelter and clothing. We need to have our water running and our heat. We need all of those things, and it's really hard for a family or a child to focus on doing complex tasks in life if they don't know, where's my next meal coming from, or I might not make it to the end of the week because my budget is tight. I'm not sure about that. So it's really important that parents have that foundation and that they've got all the basic needs that they require to be healthy and for their children to be healthy. And then finally, the last protective factor, this is really more focused on the child, and it's the social and emotional competence of children. So this is really all about children learning how to express their feelings, how to communicate. Children that know how to do that, children that can self-regulate, are going to do much better, as they're developing and growing. And this is something that's also helpful for parents to learn too. It's like, how do I help my child navigate and tell me what they're feeling, right? So combined, these protective factors really make up the strengthening families framework. And when these are high and strong, there's very good likelihood that that's going to be reflected in the families and the children as they develop. So that's why it's been really, really important for us as a CAPC to make this our focus. It gives us a common language to use with our partners, and I know many of you out there know this. Some of you are less familiar with the framework, but when we're talking about, we think it's important for this family to develop social connections. It will be nice to have partners to understand exactly what that means and why that's important. So the framework helps us establish that. It gives us a shared vision of how we can get there. What's our pathway? It's through these protective factors and building on those together. It's inclusive. It has something for every family, no matter who they are, where they come from. And it's so compatible with much of the work that we're all already doing, no matter who we are or how we're doing it. You all know this. I mean, I've heard this from county partners many times. Government certainly cannot be the savior to all the complex social issues that are out there. Neither can our family resource centers. Neither can child welfare. But strengthening families framework gives us something to rally around. It's something that can be the center of a collective impact movement, because literally everybody can be involved in some way or another, no matter what sector you are connected with. If you're a parent, if you're someone who is part of a faith-based organization, if you're a social worker, if you're a board of supervisors, something that you all can do to support this. All right, I think we're back to you, Christine.
Okay. So some of our other prevention activities is the Child Abuse Prevention Council, or CAPC. We oversee some funds which are called the Children's Trust Funds. You will see these in the community service budget, but it's actually the Child Abuse Prevention Council that determines how this funding is spent. The funding is made up of, from the state of California. It's part of the kids' license plate allocation, so the license plate with the hands on it, that money that's raised with those license plates is sent to the counties as part of the trust fund. And then also, we get a certain percentage of birth certificates here in Stanislaus County. So our budget this year is around $177,000. With that, we support the Center for Human Services, Hutton House. Hutton House is our designated teen runaway shelter for the county, if you're not familiar with them. And they provide many necessary services for teens and their families, which is so important in our community. We also partner with local hospitals who have a labor and delivery unit and other nonprofits to share videos, written material, and such with new parents to inform them of what happens if they get frustrated with the baby and shake that baby aggressively. Often out of frustration, but it can cause traumatic brain injuries and potentially death. This primary prevention strategy was actually shown to over 7,000 new parents in our community. We also provide materials and information to schools and community groups about the Safely Surrender Baby program, which is a legal way to basically drop off a new born child within 72 hours of birth at a local hospital with no questions asked. This law was signed into the state of California in January 2006 and was really intended to save lives of newborn infants at risk of abandonment. So one of the things that we wanted to share with you in the community is, I guess, the financial impact, the economy of what abuse means. And so Safe and Sound, which is the Child Abuse Prevention Center in San Francisco County, actually put together for each county in California looking at the outcomes for youth that are abused. And using specifically Stanislaus County information from 2019, and the over 2,000 kids that were verified survivors of maltreatment and one maltreatment fatality, the eventual life cost for these youth is $712 million. To put, I guess, a financial number to the cost of child abuse. With that money, just to put it in perspective, we could send 80,000 children to preschool. We could purchase over 2,000 median-priced homes in the county. We could build 22.6 miles of new interstate highways with that same amount of money. And here's the breakdown of where the costs come in. So for child welfare, there's a cost there for providing intervention services and counseling and such. You'll see education, because maltreated children are 77% more likely to require special education. Criminal justice, maltreated children are 59% more likely to be arrested as juveniles and 28% more likely to have an adult criminal record. In healthcare, you'll see rising need for healthcare, mental health services, other medical services, and have a higher incident of physical and mental health issues throughout adulthood. They looked at lifetime productivity and then the cost of fatality of our one victim due to lost wages and the healthcare costs at that time. So what's next for child abuse prevention? Child welfare was chosen as one of 12 counties in California to participate in a learning collaborative to produce effective child welfare and justice systems for families impacted by opioid and stimulant use. Our goal is, through access to national experts, to improve our programs and to keep families together. Next, there's some new federal legislation that's being implemented in California called Families First Prevention Services Act. And this will allow us to focus on families where removal of a child is imminent. We have 5 years to implement this program, and the state plans to have their final plan in July and begin implementation in October 2021. And lastly, we are participating as a Child Abuse Prevention Council with 23 other counties through a program of the California Office of Child Abuse Prevention and strategies that Lori mentioned earlier to be data-driven and ways as we as a community to prevent child abuse and neglect. So we want to thank you for your time today and your support in preventing child abuse. We would like to have Holly Grace Curry from Haven, Sandra Genova from Espirinet accept the proclamation, and also Jesus Vega is one of our members to accept the proclamations from you.
That's great. Thank you, Christine. And I'm going to have Supervisor Withrow come down to present because this is something that's near and dear to his heart. So if you want to come forward.
Wow, okay. We've got a big proclamation for you here. I'm not going to pick this up until we finish talking here. So I want to thank you guys for all you do. As I sit and listen to this, I get emotional listening to these numbers, something that we've talked about here, something that we've talked about through our focus on prevention, and it goes back to the story that I talked about Scott back when we began focus on prevention, about a 7-year-old that I encountered and the cost involved in what happens to that 7-year-old from point he's 7 until he's 17. And all the cost involved to the county in just trying to service and deal with Scott. And you spelled it out just so well here in these numbers. It is embarrassing to think that we have a $177,000 budget for you guys. And I know there's so many organizations that are working on this, but just your budget alone. And then when you look at these numbers, the costs that we incur as a result of our failure. And this goes back to I said this I think last week. We talked about Father Boyle, Homeboy Industries, and the statement that he made to me when he was here that these children have been failed by adults. And so I can't imagine a better place for us to put our dollars than to invest in these families and the work that you guys are doing here. It will change this community. It will change this country overnight. You see what's going on in this country right now. And it all stems back to the childhood and the breakdown of the family units. And I would argue all the things that you guys had here and the protective factors, I guess I would add faith to that also as one of the protective factors that's there. But faith and religion for these families. So I can't thank you enough for what you're doing. And I challenge all of us here at our local level, at the state and the federal level, to look at these numbers. And the numbers don't lie. It is so obvious what's happening to our country. And it all begins back with these children and the families and all the issues that their families are dealing with, which lead to, the abuse and everything else that these kids have to deal with. You look at our homeless population that we talk about all the time. And so many times we want to find the easy answer. It's an economic issue. We just need to build more houses and we won't have homeless. And all of us know so well. All of us who have been out on the streets, in the gutters, out in the camps with these people, it's not houses that they need. And most of their issues the genesis of their problems began as children and their families and the breakdown of their family units. That's the answer. I mean, it's just that simple if we can get back to that. Again, it's hard for government to do that. As government, we're not good at raising children, but we are good at facilitating and bringing people together in organizations like you guys to help these families get through it. And all we need to do is break that cycle, just one generation. You break that cycle and you can potentially permanently break it and change the community. If we can get one child who doesn't have to go through that, then they grow up and they get married and they have children and they know a better way. And so anyway, I just am so proud of the work that you guys do and everybody in our community that does to work with these children. It's horrific to see these numbers as far as what happened during the pandemic and the drop in the reporting that happened. And as we all know, there wasn't a drop in child abuse during that period of time. So we've really got our work cut out for us now because these are people that didn't get help, kids who didn't get help during this period of time. So thank you guys. Again, this is a very emotional thing for me, as it is for you, I'm sure, and very much appreciate the work that you do. And I just encourage all of us and challenge all of us to focus on these children, to focus on these families and the breakdown of these family units, and to try to make the difference there. And we'll put ourselves out of business. I'll tell you, we literally will shut down departments, if we could get and be successful at this. So I thank all of you for what you're doing. The board very much appreciates all you do. Here are I'm going to give you guys the resolutions that we have here. And on behalf of the Board of Supervisors, thank all of you very much for everything you're doing. Anybody else want to have anything else to say? Do you guys want to? Any other comments? Okay. Thank you guys. Come on up here. Let's take a picture. Let's all get up here.
Thank you all. Now we're going to move on to item 4, an update related to the 2019 novel coronavirus COVID-19 emergency and essential services. CEO Hayes.
Good morning, Chairman Chiesa, members of the board, once again. And I know Mary Ann and Dr. B are just getting set up, but we truly, our reports over the last several weeks have kind of bled together. It doesn't mean that we don't have a lot going on, a lot of work activity, but I think our reality is that our main focus has been on vaccine and public information and outreach over the last couple of months now. So that'll be the update today, and I'm going to go ahead and turn it over to Mary Ann and Dr. B. And I want to welcome back Dr. V from just a little bit of time off.
All right. Oh, thank you. I'm sorry, I was a little slow with the slides today. Good morning, everyone, and thank you for having us here today. I thought I'd start out with our usual cases and hospitalizations update. So you can see by this epi curve that I show each time I'm here, with the blue being confirmed, which are PCR, the green being probables, which are antigen tests. As you can see, we've come down very nicely from our peak of almost 800 in one day in early January down to certainly seeing less than 100 on average per day. So still seeing quite a few cases, but definitely decreased, definitely looking stable to slowly decreasing still. So our case rate looks quite promising. Our hospitalizations in ICU with COVID-19, the orange line is the hospitalizations total with COVID, and the red line is the ICU. Our ICU has come down nicely. Yesterday was 9, so a single digit of COVID patients in our ICUs in our county. Our hospitalizations have stayed relatively high. As you can see, they're running just under 100 to just barely breaking over 100 yesterday. So we're still seeing some significant hospitalizations in our county. We'd like to get down more, below 50 like we did last fall, but still seeing some significant hospitalizations in our county, and continuing to look into those and trying to find commonalities so that we can address who's getting ill and hospitalized. I wanted to briefly speak about the variants that we're seeing. So we have some variants that are known as variants of concern. I think everyone has heard of the B117, which is the one that was first identified in the United Kingdom. We have identified 11 of those in Stanislaus County. You can see over 2,500 in the state of California, according to their website. The B1351 is the one that was first identified in South Africa. 55 cases in California. We've had 3 in Stanislaus County. The P1 is the Brazilian variant, 246 in California, primarily southern and related to some outbreaks. We have not identified that variant in Stanislaus County. The B1427, I hate talking in numbers, I'm sorry, and the B1429 are otherwise known as the California variant or the West Coast variant. They were told from the state, you can see there's a lot of them being identified in California, very few in Stanislaus County. This variant is, we're told, about 60% of California genotypes identified, so it's the major strain here. And perhaps what's keeping the B117 from becoming the major strain there, but I'm not sure that that's true in Stanislaus County. So I put up these numbers so you can see what we're seeing. We do get notifications weekly, at least, of some variants. We got 3 more yesterday, and those are included in these slides. Actually, the B117 went up to 12 after I made these slides. So We are definitely seeing variance, but as you can see from our case rate, it still remains low. Our hospitalizations are not really increasing, still continuing to bounce around between 75 and 100, but still a little bit high. I'm going to go into our tier update. It should come out today, but from what I can see from our data, our unadjusted case rate, what we see is about 9.3, so in the red tier. Remember, we've been in really a purple tier case rate, so we're very happy to be actually in the red tier. The percent positive and the percent positive for our lowest quartile of healthy places index are both continuing to stay in the orange and have decreased. So you can see that all of these have continued to slowly improve. It really is very slow. That case rate has come down maybe 1 per 100,000 about a week. So if we remember, we were 12, and then we were 11 and 10, and now we're 9. So it's a slow decrease. We have to get below 6 to get into the orange tier. If we keep our 1 per 100,000 per week, it'll take us a few more weeks. So at least we're on the right track, and that is good news. Here is the percent positivity. I just put up the line so you can see that we do really continue to see this slow decrease. And the trends here for the case rate, again, you can see we bumped around a little bit high, but a really slow decrease still continuing to happen for the last month. As we look into the vaccines, we have Stanislaus County residents have received over 314,000 doses as of the data I had yesterday. Of the eligible population, which is ages 16 and older, and that's about 430,000 Stanislaus County residents, 48% have received at least 1 dose. We're really getting close to that 50% mark, which is great. 29% fully vaccinated, 19% partially vaccinated. So we're getting closer to where we need to be. It's great protection for our community residents, and we're very pleased that this is going so well. If you look at the vaccinations by day, you can see we're still running 5,000 to 6,000 vaccines being given to Stanislaus County residents every single day, which is great news. Obviously, there's lots of partners out there because that isn't just public health doing those vaccinations. So it's a whole community-wide effort with vaccinations. I wanted to just briefly talk about Johnson & Johnson because it's been in the news quite a bit lately. The vaccine that was put on pause by identifying some rare blood clots. So when they reviewed the data last Friday, this was up to 15 cases have been identified and about 8 million doses given. It was 7 point something. And all were women. 13 were below the age of 50, so there were 2 that were above the age of 50. So it appears to be, and the unique thing about this, of course, is the platelet count is low. They're clotting, and platelets usually are the ones that cause clots. So usually you don't see a low platelet count and clotting. So it's an unusual disease, and it's caused by an antibody against the platelets that is being produced. So it's really quite a rare. So the incidence is running somewhere between, depending on your age, 2 and 7 per million doses of vaccine given. If you've been following COVID pretty closely, you know that the risk of clots when you get COVID is quite a bit higher than that. So as we look at risk and benefit, it is still of benefit and safer to get a vaccine than not to get a vaccine. But the pause has been lifted, and we are looking at how we can put this back into our clinics to use, knowing that it is safer than disease, of course. What we need to do is be able to offer a choice if there is anyone, and certainly females, between the ages of 18 and 49 who would prefer not to get it. We want to make sure that they have a choice. I think that's easier in our mass vaccination clinics because we advertise fully that it's Johnson & Johnson, so you're making a choice when you come that day to that clinic. But as we look at doing our outreach, we need to find ways to ensure that the information is given about the small risk of blood clots and how we can give a choice. So that's going to take just a little bit of time for us to get put in place. But it's great news. I'm really pleased to see how well our vaccine safety monitoring is going. So it's working pretty well, and it's nice that we have this choice of the one-shot dose to continue to offer to people. So I'm going to turn it over to Mary Ann to talk about the EOC update.
Thank you. I'm just going to quickly recap what we did last week. You want to go to the next? Sorry. Thank you. Okay. So this gives you an idea of the public health vaccination activity from last week, operating still in the 4 regional mass vaccination pods. And then we did 2 mobile pods, one in Ceres and one in Keys. Show you the volumes of the doses administered last week. And I just want to point out that first dose, I don't think at this point that's really a reflection of demand, because we did experience some scheduling issues with the system that has been solved. But when the public went on, there were times that it appeared there wasn't an available appointment slot. So, like I said, that's been fixed. So we're anticipating greater numbers this week. And this is the look at this week's schedule. You can see we're operating at all 4 of the regional sites. Yesterday we were in Empire. This afternoon we'll be in Crow's Landing. And later in the week, we're doing a closed pod for agriculture. And then this is what it's just, I think, important to keep the community informed that this is probably the best way to find access to an appointment to get a vaccine, to go to the My Turn system. And that, there's lots of updates that are always going on, so keep checking for the appointment that you want. Or you can access the system through by phone, and so that the number is there. And we want folks to get vaccinated. We want to increase that percentage of vaccinated in our population. But while we work at that, we still need to take precautions. And testing is an important part of the strategy. So I've got that up on the slide as well to show you where the testing locations are. And I'm going to turn it back to Dr. V now.
So in closing here, I put this map of the United States up there. This is from CDC yesterday, looking at spread and disease transmission. And as we've been hearing about Michigan and the East Coast being in surge again, Michigan probably leading the way on that, you can see it's come across the country. And Washington State was talking about now being in surge, starting to see some hints of that. You can see Oregon starting to turn red with higher transmission as well. And while California is doing well, I just find it hard to believe that we're going to avoid the next surge coming. It's kind of hit the whole world. I don't know why it would skip by California. We can hope, but we're preparing for seeing an increase in cases coming at us, because all the other waves have started from the east, started from Europe, gone through the east, come across to the west, and so I don't know why we would be spared, sadly. So as we close, I just want to remind everybody that the way we prevent getting sick is, this is called the Swiss cheese model, and it's really true. There really isn't one thing. I think it's emerging evidence now that vaccine might actually be the one thing that has almost no holes in it. But it really takes multiple layers to stop transmission on a personal level and on a population level. You can see the distancing, staying home if you're sick, just basically keeping your air to yourself. The masks, the ventilation are probably the 3 biggest things we look at. So outdoor is obviously the best ventilation. So as we look at perhaps an increase in cases, and as we look at coming out of this pandemic, people need to think about where they're going and what they're doing, and this needs to be choices that we made, right? The choices are increasing, and we need to have choices. If you're going to be in a crowded indoor place where there isn't distancing, that's probably the place you really want to wear a mask. Okay, and then, but if you're outside and you're able to stay distance, well, then that's a lot safer, and then masks are going to become less important. So as we move forward and are coming out of this, I think this is really important to keep in mind the different layers that you can put on to protect yourself and to protect your loved ones. So thank you.
Perfect. So quickly, yesterday I received a call from a constituent down in the Turlock area. They were asking me about school athletics, and the gist of it was that they thought maybe there was a fundamental unfairness that the county was dictating the testing schedule, and I've heard some people now punting and saying the county is in charge of these things. Do we have anything to do with athletic testing requirements or the such?
No, that's under state guidance for youth and adult sports, and that's California Department of Public Health guidance, yes.
And there was, he tried to explain, the gentleman tried to explain that there was some sports that the testing was more rigid, I guess?
Yeah, and so the way they wrote the guidance, and this was from a lawsuit down in San Diego, so the way they wrote the guidance, if you're going to play out of tier, so they have the sports and they have divided into what tier they played at. So if you play out of tier, like you're playing football when you're in purple tier, like we were, then you have to have a testing program. If you play basketball out of tier, I think you have to be in orange for indoor sports. Then you have to follow the collegiate guidance, which requires testing. So it refers to the collegiate guidance, which you can look at NCAA or some of those, to play out of tier. If you're playing in tier, like tennis, golf, which is the outdoor sports that are in tier, then there isn't a testing program
Okay,
required.
so the county is not dictating, it's the state guideline. We don't have a special order in place. I just want to be clear. Okay, thank you. Other questions?
Thank you. Thank you for the presentation. As always, very informative. And then I also wanted to talk a little bit about what Chairman Chiesa was just talking about, and acknowledge and appreciate the help that Dr. V provided in reaching out to the California Department of Public Health, specifically on tennis and golf. So I got a call from one of my constituents who, unfortunately, her daughter had a pretty horrific injury because of what the parent described as wearing a mask during a tennis match. But you were able to provide and work with the school district, work with CEO Hayes about the mandate on wearing masks on outdoor sports. And it was interesting when we dug further and further, it actually said low contact sports, and that was the state's guideline, like tennis and golf don't require masks during competition. But I think the answer was you still have to follow it, even though in their own guidance it says it doesn't. But I'm hearing and I'm hopeful that in the next few days that CDC is coming out with new guidelines. Is that what you're hearing as well?
Yeah, so I was told today that they're supposed to announce that mask wearing out of doors is probably less important or not required or whatever. That's CDC, they're still the state mask, and so the state would have to change their orders because we're under state orders. So
how
yes.
confident are you that CDC or the state would try to align with the CDC, which would make the most sense since everybody's following the CDC guidelines?
Yeah, I've given up trying to predict what people are going to do. So I haven't heard anything about it. I haven't heard it mentioned on phone calls. And in fact, I just heard about it late last week. Anthony Fauci was saying something. And then yesterday, I think President Biden said something. So I don't know. I haven't heard it from CDPH at all. And so I hesitate to comment because that's the way bad information, it seems like, starts, because then I'll say something and it goes.
Well, hopefully
Sorry.
the state sees just as the CDC guidelines, because I think the test of common sense would be outdoor sports are probably better for the athletes. I see people on Dale Road running at Gregory High School with masks on, and now what's going to be 90-degree weather, so it just doesn't make sense. Doesn't pass the test of common sense.
I couldn't agree with you more. And just to prove, it continues to be very fluid and confusing, even not for our experts, but we sit and listen to this over and over and over again, and it's continually changing. So appreciate the report. Okay, no other questions?
Thank you, guys.
Thank you. Okay, now we're going to move to the public comment portion of the meeting. It's an opportunity to speak on anything that is not on today's posted agenda. Please come forward and limit your comments to 5 minutes. I do have one card from Steve Handel. Good morning, and thanks for sticking around.
Good morning, Chairman, gentlemen of the board. Am I able to drop the mask while I talk? Or no?
Yeah.
That feels much better. My name's Steve Handel. I'm here on behalf of the Waterford Sportsman's Club. If you're not familiar with that, it's about 20 miles east of here. We're a sportsman's club. We have campground, camping. We shoot rifle, handgun, pistol, archery. We do a lot for kids out there. And the main reason I'm here is we're without a well. We've been without potable water since last June. The biggest holdup is Stanislaus County and the requirements for the regulations to drill a new well. we're considered a public entity by the county, and when I think of public entity, I compare it to McDonald's, which is 2 blocks from here. They run thousands to millions of people a year through there, and they need water at certain specs for that, and I get it. We're out in the county. We run 4 events for members, and some public is invited. And when I'm talking an event, one of our dinners, we might have 75 people. 100 is pushing it. Usually it's 75, somewhere in that range. So we don't do a ton of water. We do have a resident that lives on the property in a mobile home. There are caretakers. It's a husband and a wife. They've been without potable water for June will be a year. So I want to see if there's any help that I can get from you guys to get this well so we can get it installed. We don't have, we're a nonprofit organization, so we don't have a ton of money. The county is asking that we do a engineered drawing on the well. At the end of the day, we want to drill a hole and get water up that we can use. We understand the regulations. There's nobody in this county really that is helping us to do an engineered drawing. We've been fighting it for a year. So I just want to see if you guys can offer any help to get some potable water for us out there.
Okay. Do you know the address of the Sportsman's Club?
Yes. 13443 Tim Bell Road.
Okay, we have our Environmental Resources Manager right there. He's going to talk to you first, and then we'll have a discussion. Him and I will have a discussion about this. Appreciate you coming. Okay. I didn't know anything about it, so.
Thank you. Appreciate it.
Right. Anyone else for public comment? Okay, seeing none, we're going to move on to the consent calendar. Did we receive any comments for public comment?
We did not receive any written comments submitted.
It's the first time I've said that. I completely missed it every single time, but now I'm going to get it. All right, now we're going to move on to the consent calendar. I do have one speaker card that wants to speak on B5. Any board member want to pull any items? Anyone in the audience have any comments on any other items? Okay, so Karen Hennings from the Healthcare District.
Good morning, Chairman and Supervisors. Thank you very much for hearing me this morning. I just want to say thank you for considering bringing the support of Stanislaus County to the special districts throughout the state, and especially the 72 districts that we have here in our county. Special districts have been excluded from Cures Act and the American Rescue Act plan specifically, but allowances happen at the state level and at the county level to be able to share some of the funding to help offset the losses of revenue and the extra costs that we've experienced. I represent Del Puerto Healthcare District along with Oak Valley Hospital District and Westside Community Healthcare District. We cover 76% of the county geography and 23% of the population. We've been working very steadily throughout the pandemic, and your support in bringing our cause to the state level to look for assistance and funding is greatly appreciated. Thank you.
Thank you very much for that. And I just want to acknowledge Supervisor Chance Condit. Obviously, healthcare is one of his areas that he's extremely interested in, but he had met with Karen, and then we all got together. So thank you very much for that.
Thank you, Mr. Chairman.
All right. If there's nothing else, one of the items does require a 4/5 vote. It is item B6 regarding the reduction in force of filled positions for Public Works Local Transit System budget. There's a reason for that because of the conversion to a joint powers authority. So it's not actual loss of positions. I just wanted to make that clear. So with that, I'll entertain a motion.
Motion to approve.
I will second that.
We have a motion and a second. All those in favor say aye.
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 Opposed? Motion carries 4-0 unanimously. Thank you. Okay, now we're going to move on to item 8, discussion item, approval of the Stanislaus County Workforce Development Local Plan and San Joaquin Valley and Associated Counties Regional Plan for program years 2021 through 2024 workforce development. Doris Foster will be presenting. Just while he's getting that ready, I'm going to ask the clerk of the board, are there any comments, written comments on this item?
We have not received any written comments for
Thank you.
items today.
Good morning, Chairman Chiesa, members of the board, Chief Executive Officer Hayes, and County Council Bowes. I'm Doris Foster, your Director of Workforce Development, and with me is Adolf Lopez, and Adolf is the Manager over Contracts and Planning and the Regional Organizer for our region. And he's also responsible for the regional plan. So before you today, we will be presenting the local and the regional plan. Our mission at Workforce Development is to work with businesses to determine the needs of in-demand occupations and develop a skilled workforce that strengthens businesses and contributes to the economic success of our community. To accomplish that mission, we receive a little over $18.6 million with 92 allocated positions. There's a variety of positions and programs that we administer with Workforce Innovations and Opportunities Act, being the largest at 45%. The next largest program is Welfare to Work program at 42%. The rest of the programs are smaller, yet just as important. We provide services to the homeless through the Downtown Streets program. We additionally work with justice involved through the probation department in the commitment facility and with the sheriff's department in the prison to employment program. We also do rapid response, which is working with our businesses who are doing reductions in force. 4% of our direct funding this year was to work with businesses and dislocated workers as a result of COVID. The final area is our regional plan that Mr. Lopez will address shortly. And this pie chart is really important as we start to address the local plan. The local plan is required through the Workforce Innovations and Opportunities Act, which is the blue piece of the pie chart that you see. 3 years ago, we came before you and asked for approval to move business services into the department in order to focus on assisting clients to obtain self-sufficient wages. This also allowed us to braid our funding and create co-enrollment. Operationally, this has changed services to look like this pie chart. By co-enrolling clients and programs, we're able to provide more services to clients and more skilled labor to businesses in the community. The goal is to have 91% of our services co-enrolled, but that's not quite reality right now. The reality is probably closer to 65–70%, but we consistently see the number go up year after year. With this goal of increased co-enrollment, we are seeing the local plan addressing the majority of services that we provide to the community, not just the 45% of the Workforce Innovations and Opportunities Act that we saw in the other pie chart. Local plan. Since the inception of Workforce Innovation and Opportunity Act, this is the second local plan. The local plan is for 4 years, which begins July 1st of 2021 and ends June 30th of 2025. Every 2 years, the plan must be reevaluated for modification and adjustments based on needing changes for services and economic conditions of our local area. The primary purpose of the local plan is to facilitate access to workforce services at the local level. The plan addresses current and future strategies and efficiencies that will continue the modernization of the workforce system. An important thing to note is that the Workforce Innovations and Opportunity Act is a federal program. So as we go on in the program, you're going to see that the local plan is defined as program year 2021 to 2024. But because we are the funding goes through the state, and the program year is different. The fiscal year is 2021 to 2025. In developing the local plan, we took a look at labor market information. This slide is very important as it shows the discrepancies between postgraduate and graduate degrees held by Stanislaus County residents as compared to the state. We have more higher school graduates and considerably less individuals with the bachelor's degree program. And you'll see this information is important as we start talking about our plan and how we plan on really working to change that. In this next chart, you see that Stanislaus County workforce population has a reasonable distribution of the population in terms of age. The segment of the population ranging 25 to 59 account for 58.6% of the overall workforce, while workers aged 16 to 24 represent the smallest percentage of working age individuals at 16.7% of the working population. This is one of my favorite charts. This chart for me is very telling. The blue bar is the labor force participation in Stanislaus County by age. The gray bar is the unemployment rate. This chart shows the youth section of the labor spectrum is having difficulty entering into the workforce. Only 31% of the youth from ages 16 to 19 participate in the labor force, and the unemployment rate is a 19%. In contrast, 48% of the 60 to 64-year-olds are still participating in the workforce and have an unemployment rate of only 5%. The lowest unemployment rate and the highest labor participation rates are predictably in the 30 to 59-year-old categories, considered to be the prime working age. The primary purpose of the local plan is to facilitate access to workforce services at the local level in order to achieve three goals: strengthening the current workforce, developing future talent, and support business growth. The state has identified 14 partners that work together in part of the American Job Center of California. These partners, workforce development being one of them, are dedicated to developing an educated, skilled workforce that strengthens businesses and contributes to overall economic success. It is with this primary focus that the department strives for effective coordination of all services within the partnership. The department continues to grow the strategic goals established under the previous local plan. These partnerships with strategic partners are included in the state plan. Recently, we applied and were awarded to participate in a cohort training with the federal government for a 6-month training on CalFresh employment and training. Only 10 areas were chosen across the United States, Stanislaus County being one of them. Additionally, we continue to work with our local Department of Child Support to enroll mutual clients. Intellectual and development disabilities is new for our department. We have started discussions with the Department of Rehabilitation on mutual and supportive services. The department has increased services to the Spanish-speaking population and now provides Spanish orientation, work keys assessment, resume workshops, and CalJobs navigation workshops to Spanish speakers. Staff have been fostering relationships with service groups including El Concilio, the Hispanic Chamber of Commerce, and City Ministry Network to increase the awareness of our programs. Training and professional development of staff is projected to continue to be very important over the next few years. Training related to cultural competencies is planned, and staff have a cultural awareness work group, which enhances the understanding of the importance of multiculturalism in the organization. Additional training includes specialized groups such as previously incarcerated, homeless, veterans, and youth. Coordination of services includes working with partners in business closures, dislocated workers, and contracts with Small Business Development Center. The department has many programs available for businesses such as on-the-job training, incumbent worker, and apprenticeship programs. Youth services. As we saw earlier in that chart, the labor market information, the youth have the greatest unemployment rate. As a result, the department is placing an emphasis on the expansion of youth services with the expectation to grow in both scope and ability. We are working very closely with community college to assist youth who are coming close to graduation to obtain paid internship experience. Our goal is to become more involved with high school level, understanding that we may have some restrictions due to federal requirements of age. Job seekers can obtain services at any of our local areas. We're located in Patterson, Oakdale, Turlock, and Modesto. These America Job Centers of California are open to anyone looking for employment. Those that are interested in enrolling in our services can obtain individualized services by enrolling on our online, which is stanworkforce.com. I'm now going to turn the presentation order over to Adolf Lopez, who will present the regional plan.
Thank you, Doris. Adolf Lopez, I'm Manager of Contracts and Planning, Stanislaus County Workforce Development. I also serve as the regional organizers for San Joaquin Valley and associated counties. Doris touched on the local plan. Part of that process, as a receiver of Workforce Innovation Opportunity Act funds, we are also required to complete and submit a 4-year regional plan. Part of that strategy is in relationship to local, to regional, to state. They all need to be connected and coordinated in that process. The state strategic plan focus objectives is to demand-driven skill attainment, achieving income mobility for individuals with barriers to employment, and system alignment among regional organized local boards and their partners. The regional plan provides a roadmap for alignment of resources and investments to meet specific outcomes within the 15 regional planning units in the state of California. Regional plans are used to articulate how each regional planning unit will build intentionality around industry sector engagement, drive workforce development outcomes across multiple jurisdictions, and expand on-ramps to career pathways for individuals who experience barriers to employment. In summary, the state plan provides the outline, the regional plan provides the roadmap, and the local plan provides the action plan. There are 8 different workforce development boards who encompass the San Joaquin Valley and associate counties. Of those 8, we comprise of 10 overall counties. They consist of Fresno County, Kern, Inyo, Mono counties, Kings, Madera, Merced, San Joaquin, Stanislaus, and Tulare. The 15 regional planning units, as I specified earlier, designated by the governor and the State Workforce Development Board, are organized as part of the California Strategic Workforce Plan to develop a regional plan that addresses the objectives of the state plan. In the process of developing the regional plan, Workforce Development went through the process of the county procurement, and we're able to procure a regional plan writer and facilitator. Gentleman's name is David Schinder Consulting Services. In addition to that, we procured a company to conduct the analysis of the region, and we went ahead and selected Resource Development Associates, also known as RDA. They also are the author of the recent commuter report study that we produced and presented. The regional plan process is identifying the regional forum topics, and that's part of the process. So we, in the process of connecting with stakeholders, we conducted 10 regional forums in the north and south areas of the valley. Of those 10, 2 of those were facilitated in Spanish, and from our knowledge, we were the first workforce development region to be able to do that in the state of California. The topics include the regional economy through the eyes of business in the community, accelerating the development of career pathways for priority sectors, building a big tent, workforce system leaving no worker behind, and the last topic was creating a pathway to the middle class. Part of the process in using the research development entity, RDA, is they conducted a thorough analysis of the region and areas that were defined. Part of the regional plan process was analysis of the region's current employment and underemployment data, education and skill levels of the workforce, employer needs, skill gap in industries and occupations with emerging demands. The data itself defines what are occupations and industries that are in demand, what are the gaps, what are the educational needs, and then those are things that we can use the data to be able to strategize, to be able to assess and improve what we do. Regional plan priorities. Fostering demand-driven skill attainment. You will notice a consistency with our state plan. Enabling upward mobility for all Californians, and aligning and coordinating, integrating programs and services. The regional plan identifies the in-demand industry sectors and occupations and strategy on growth and development and implementation of sector initiatives. For enabling upward mobility, the plan describes how the region will prioritize working with employers who provide quality jobs, sustaining wages, and comprehensive benefits, including strategies in identifying shared target populations and service strategies, in coordination with employers and training providers to ensure underserved communities have equal access to services and programs. And lastly, aligning and coordinating integrating program services. The plan describes how the region will work on aligning, coordinating, and integrating programs and services region-wide. I'm going to turn it back to Doris.
Thank you, Adolf. So we've always had a regional plan ever since we always started, but it's new for Stanislaus County to be the regional organizer. We have been in that position for 1 year now, and as Adolf said, there's 15 different planning units, and so we oversee ours. And so it's been a really busy year for us, even during COVID, to kind of navigate through this. And I just want to say I'm very proud of Adolf and the staff. They've done a wonderful job as we've developed the regional plan. The other directors in our region are extremely pleased with the plan and very proud of the work that we were able to put together. So lastly is our staff recommendations. They are to approve the Stanislaus County Workforce Development's local plan for program year 2021 to 2024. Authorize the chairman of the Board of Supervisors to sign the local plan, and approve the San Joaquin Valley and Associated Counties Regional Planning Unit regional plan for program years 2021 to 2024. And we're available for any questions.
Do we have any questions for staff?
No questions.
I'll just come, sorry. I will just have a couple of questions. First, thanks, Doris and Adolf, very well done, and congratulations on being the regional, what's the term?
Organizer.
Organizer, there
and
we go.
regional trainer. It's a
Very
long
good.
title for him.
Very good, thank you. Anyway, great work, and congratulations on that. The youth services, which you pointed out, Doris, and talked about the ages 16 to 24, so about a 32% unemployment rate between those age groups. And so I just think of back at that day when I was that age, and the first thing you did when you turned 16 was go get a job at McDonald's or Arby's roast beef sandwich. You know, you went and found that first job. And so you said you're working with the high schools and then with the community colleges. What kind of work are you doing with them, and are you getting much reception from them? Are they working with you, or just how's that going?
So we've created a couple different programs. Exactly what you said. I remember my first job. I remember, the impact it had. And those jobs aren't available for our kids these days. And so we've created a summer youth program. It's our 4th year that we're doing it, and we bring kids in that are either through WIOA or non-WIOA, and we really try and focus on those that have barriers to employment, that don't have that assistance. Even during COVID, we've got quite a few kids that are coming through that program. The other things that we've really focused on is we've been working with Modesto Junior College and Stanislaus State in creating an internship program. So we've dedicated approximately $1 million for this service to be able to, when these kids are just getting ready to graduate, within that last year, for 6 months, we want to put them in a work experience that's related to the job that they are training in. This is useful for numerous reasons. We have read over and over again that, like in our community study, that people are leaving. And even some of the youth that are coming here to get educated, we feel that if they could have a tie to the community, it would keep them there. That will help our attainment rate for increasing the amount of people with college degrees in our area. Additionally, we've been really working on doing a lot more work experience with some of the schools and the training. So for example, we're working with Bay Valley Tech. And so as soon as they're in that program, we're also letting them do a work experience at the same time so that they can start getting something that they could put down on their resume. The high schools are a little bit harder, and that's where we come into some problems because we really can only serve 17 to 24, and yet that's where we're seeing the issue. So it's really the seniors that we're able to help. Those are the seniors that we are really trying to work through our summer youth program and trying to establish more and more programs. We did have one program that we're starting to work with, Turlock High School, and it's to create an apprenticeship program and working with the students that are graduating to get them into some sort of a training immediately.
So when you say you're having, it's a little bit harder with the high schools, and so it sounds like Turlock is it. Modesto City Schools, are they working with you on that? Do they have their own program, but they just think we don't need you, we've got our own program? It's just such a kid needs to learn, right at that age, this is how a job works. And it's such a great thing for them to start with. So the high schools have that already going, or just? So
a lot of the school districts have an adult school, so we work with their school as well as some of the high schools. So all the schools are working with us.
Okay.
That's not our problem, Supervisor Withrow, it's the kids. As I told you, we allocated $1 million. I can bet that we haven't even spent $100,000 yet. The kids are just not wanting to work, and we're trying to somehow motivate them, get them into even some sort of training to motivate them. We're just not seeing this big rush to take advantage of these programs.
Yeah, it's too bad the high schools can't, as a condition of graduation, somehow tie us. Just like we have volunteer units that need to be done. It'd be great to. Anyway, that's a school board issue. But again, it'd be great if we could get them to do more with.
We've been having those discussions with Stanislaus State, specifically with President Ellen Junn. And so we've been talking about how we can take some of those classes. We met with all of the deans and talked about how some of the classes we could make something a little more mandatory. The problem is they want to do credits for it, and that becomes a little problem for us because credits is already required. We can't use government funds for that. So we are working towards it, and hopefully we can get something going. We're hoping that it's not just because, we're hoping it's just because of COVID. We're hoping that once that releases more of these individuals, these youth will want to start working. But we keep promoting and we keep trying to pound the pavement because that's really important to us at this point, and we see the greatest needs in our community.
Great. Very good, thank you. And then this is as a side note, I saw part of your budget there was a downtown streets team. And I know we've talked about that, and I bugged Jody about this, I know, and I had a conversation with Dana Bailey about this. Our current, our downtown streets team has a waiting list of about 44 people last time, as of 3 weeks ago. And we were looking to try to expand that, and I know we're trying to figure out ways to do that. And I know the city of Modesto was involved in some of the funding of that, we're involved in that. And the hope was at some point to try to get other agencies involved, and because it's a great program, everybody sees it, loves it. It's great for these individuals to really get a feeling of worth. They're out there. It's great for the public to see people who are homeless actually out there working, cleaning the streets and stuff, and it really helps these people transition into further employment. And so the thought was with this that we were going to try to get other agencies, and specifically I think the utility, MID, TID, to get involved in some funding for this. So it's terrible that we have a waiting list. The fact that we have people that want to do this and we're not able to get them out on the streets because of funding. So I just want to encourage again for us to really pursue how to expand this. I know Greg Pensinger,
yes,
I spoke with him and then went on and so we would love to expand and get everybody who wants to be a part of this out there and working, and funding shouldn't be an issue for this thing. So anything that, I don't know what you can do about this door. Sorry, you're just the person who's here as I'm talking about it. I'm sorry, but when I saw it on your budget, I just, I really want us to try to expand that. So
absolutely, and we have been in discussions with them. Our piece of it is we like to pull in higher education, so we've been working with Modesto Junior College, who started to put together a educational program portion of it. And if we can tie it to some education, we can do more of the work experience where we can actually pay them and run them through our program. So we have been working towards really amplifying the program that's currently going on. If we tie a educational component, we're allowed to put much more funding towards it. And that's kind of where we've been working towards. We've been working closely with City of Turlock as well as City of Turlock, who's very interested in implementing a program similar to that. So.
Perfect. Thank you guys. Thank you guys very much today.
I'm going to move the mic back a little. I've already got a reputation for yelling into the mic, so start gauging my voice decibels that come out. But thank you so much for the presentation, Doris and Adolph. It was my second look at it because I do sit on the Stanislaus County Workforce Development Board. But in the community, I want to commend you. Every time I bring up the Workforce Development Board or don't bring it up, it's always in a positive light. I know you mentioned Dr. Jun at CSU Stanislaus. I had a meeting with her, and she was also talking about how helpful you've been in directing some of their student body at jobs and things as such, and then the grants program. So I just want to commend you on what you and your team are doing. I know the last meeting we had was a little lengthy, but how it was carried by Chair O'Brien and yourself, done very well. So I really appreciate it.
Thank you, and we're glad to have you on the board.
Thank you.
Perfect.
How was that?
That was good. That was excellent.
No yelling. No yelling.
So again, I appreciate, in times of COVID, our public health department has increased their workload exponentially, and unemployment and employment opportunities have been first and foremost on our mind. I know you tried to intimate that you've tried to work through it, but you guys have worked really hard through this whole pandemic, and I appreciate it. So Adolph, nice to meet you. Great presentation. Thanks, Doris.
Thank you.
Okay, so we do have some action. We have to take, and there were no public comments for this item. I'll entertain a motion.
Okay, so I'll move to approve the Stanislaus County Workforce Development Local Plan.
Thank you.
I'll second that motion.
Okay, we have a motion and a second. And before I do, I'm going to ask if any of the members of our team wanted to come up and speak, since there are no public members here. But I'll ask anyways. Seeing none, bring it back to the board. All those in favor say aye.
Aye.
Opposed? Motion carries 4-0.
Thank you.
Unanimously. Thank you. Move on to correspondence.
This board has received a notice from the San Joaquin Regional Rail Commission regarding the availability of a draft environmental impact report for the Altamont Commuter Express ACE Series Merced Extension Project.
Refer to the Department of Planning and Community Development and the Department of Public Works.
This board has received the claims as noted on the agenda.
Acknowledge receipt of claims and refer to the Chief Executive Office. Is there any Board of Supervisor reports?
I do, Mr. Chair. Just real quick, I would like to thank Public Works Department Supervisor Bill Martins for his crew for the exceptional work they have done on an alleyway cleanup in District 5. To highlight a recent example, a constituent requested an alleyway cleanup through our office, and the crews were able to clean up the alley and close the request in just 4 days. So that is exceptional work, and we really appreciate all the efforts by our team, and keep it up.
That is great to hear. Great to hear. Any other board? Okay. I just wanted to mention yesterday, Sheriff Dirksey and myself, we had a community meeting out at Mountain View, right next to the baseball park, corner of Crow's Landing and West Main. And it was a constituent request regarding, again, illegal grows. There were a few issues that came up, but it was interesting to see, because it seems a lot of times you show up at a meeting where people are angry. Instead, people were trying to be helpful, and it was just a great collaboration, and thanks to Sheriff Dirksey for his ability to get through these issues that are very difficult, for sure. All right, Legislative Fiscal Management Report, CEO.
No report today, thank you.
Great. We do have a closed session.
Yes, we have closed session this morning still. Conference with the Chief Executive Officer, threat to public services pursuant to Government Code Section 54957, Subdivision A. The board will confer with the Chief Executive Officer and County Council regarding matters posing a threat to essential public services and the public's right of access to public services or facilities. Our second item is a conference with legal counsel, existing litigation pursuant to Government Code Section 54956.9, Subdivision D1. We have two cases, UFCW and Employers Benefit Trust versus Sutter Health, and that's case number CGC 14538451, and People of the State of California, ex-rel Xavier Becerra versus Sutter Health, and that's case number CGC 18565398. Those cases are combined. So with that, it would be appropriate for public comment.
And do we expect a report out?
We do not expect a report.
Okay, is there anyone for public comment? Right now, before we move into closed session, I want to make sure we get the link, because the link wasn't working right. If you typed it in, the link that you sent me worked. We need to get that posted on our website, and make sure anyone that's watching the YouTube link, you subscribe. That's the important part. That's really what we need, is 100 subscribers to get a direct link. And so anyways, appreciate everyone being here. If there's nothing else for the good of the order, we're going to adjourn to closed session.